Dear friends, now I am going to discuss the sympathetic nervous system and its distribution. We all know that sympathetic nervous system is also known as thoracolumbar outflow because the preganglionic neurons will arise from the thoracic and the all thoracic segment and the first and second lumbar segment. This is the region from which the preganglionic neurons of sympathetic nervous system will arise. Now how they will move? From first four thoracic segments, the preganglionic neurons will move and end into their respective ganglia. This is preganglionic neuron which is ending in the first, second, third and fourth thoracic ganglia. But it's important to note that some fibers will ascend and they will end in superior cervical ganglia, middle cervical ganglia and inferior cervical ganglia. Even some fibers from fifth thoracic ganglia may also ascend to reach the same. Now the preganglionic neurons will end here and the postganglionic neurons will arise. The postganglionic neuron that will arise from the superior cervical ganglia will supply to molar muscle, muscle of iris, lacrimal glands and salivary glands. The postganglionic neurons that arise from middle and inferior cervical ganglia, these will supply mainly to the thoracic structures like esophagus, heart, trachea, bronchi, lungs, and even some branches may be given to the thyroid gland and the parathyroid gland. The postganglionic neurons that arise from the first and the second thoracic ganglia, these supply to the blood vessels and glands of head and neck, and in addition these may supply to molar muscles and the muscles of iris, while the postganglionic neurons that arise from the third and fourth thoracic segment, thoracic ganglia, will supply to the structures of thorax. Now from T5, the preganglionic neurons arising from T5 and onwards will behave some differently. Now what will they do? They will not make any synapse in the ganglia. Instead they will cross the synapse. T6, T7, T8, T9. The preganglionic neurons will cross the sympathetic ganglionic chain without any synapse, without making any synapse, and they will combine to form greater splanchnic nerve. This greater splanchnic nerve will enter the celiac ganglia of its own side. I am rubbing this, the ganglia, celiac ganglia of this side. This is celiac ganglia, and they will end in it. This is celiac ganglia. This is aortico-renal ganglia, which is the segmented off component of the celiac ganglia. It is also the part of celiac ganglia. Now the preganglionic neuron from T5 to T9 will cross the sympathetic ganglionic chain, will become greater splanchnic nerve, and they will end in the celiac ganglia. From here, the postganglionic neurons will arise, and these postganglionic neurons will supply to liver, gallbladder, pancreas, spleen and stomach. There is a little variation. Some fibers may cross the celiac ganglia without any synapse, and they will end on chromaffin cells in adrenal medulla. These are chromaffin cells. in adrenal medulla. These chromophore cells are themselves modified post-ganglionic neurons, and they will secrete adrenaline and noradrenaline in ratio 85% is to 15%. Now, in the same way, preganglion neurons from T10 and T11 will also cross the sympathetic ganglionic chain, and are termed as lesser splanchnic nerve. This lesser splanchnic nerve will enter the aorticorenal ganglia without synapsing. It will end into the superior mesenteric ganglia. This is superior mesenteric ganglia. This is inferior mesenteric ganglia. This is superior hypogastric plexus, and these are two inferior hypogastric plexus, and these are right and left hypogastric nerves. Now, the preganglionic neurons from T10 and T11, they will cross the sympathetic nervous system, sympathetic ganglionic chain, will become lesser splanchnic nerve. They will enter the aorticorenal ganglia, and they will cross them without any synapse, and they will end in the superior mesenteric ganglia. From here, the post-ganglionic neurons will arise, and they will supply the distribution of your territory of superior mesenteric artery. Now, which organs are in superior mesenteric artery? Small intestine, cecum, vermiform appendix, ascending colon, and the proximal two-third of horizontal colon or transverse colon. There is another splanchnic nerve from thoracic region, and it is termed as least splanchnic nerve. This least splanchnic nerve will not make any synapse in any ganglia of this region, but it will directly end into the renal ganglia. And the postganglionic neuron will arise to reach the kidney and nearby region. Thereafter, the preganglionic neurons will arise from L1 and L2. Now, this L1 will also cross the sympathetic ganglionic chain, and this L2 will also cross the sympathetic ganglionic chain, and these are termed as lumbar splanchnic nerve.